Hey guys and gals, today's video is going to be titled Conventional, Unconventional, and Ditch First Aid, and I'm going to be your host, the Homestead Prepper. I'm making this video, guys. I had a little back and forth with someone who said they were an EMT student, and I asked them a couple questions, like they knew what a tension pneumothorax was, and they knew how to treat one with a needle and an occlusion and all that. And they didn't like my idea of unconventional medicine when regular medicine runs out of salt, sugar, stuff like that, which I'll get into a little bit later in the video. And they said that would cause infection, and it was microbial and all that. So I said, well, let me ask you a question, okay? You're out somewhere and you don't have your trauma kit with you, and you see someone develop a hole in their chest cavity, okay? How would you treat it? He said he would take his t-shirt off and shove it in there. Okay? I said, okay, I got two questions for you. All right, one is your t-shirt antimicrobial and sterilized? And number two, how would you treat the patient if emergency rooms and urgent care centers were not open? Okay? You know what? They didn't have an answer for me. So that's what this video is about, guys. Now, my disclaimer is this video is for information purposes only, and this video is not here to cure, treat any disease, trauma, wound, first aid, anything like that. It is for information and entertainment purposes only, okay? And guys, this stuff I'm going to be doing here, mainly I'm going to probably be doing it to myself, For example, if I had, if the crap hit the fan and hospitals and emergency rooms weren't open, or it got so affordable that you couldn't go, which I recommend that if you can, get proper medical care, I recommend you get that before you resort to other means that might be dangerous or you don't know what you're doing. But if I had a, the crap hit the fan, and let's just say hospitals were not open, urgent cares were not open, and someone, got a cut on their hand and it started to get infected, and they came up and they asked me, and they said, well, do you have any of this? Well, if I had some of this, and and there was a doctor around to prescribe the right dosage, then that's what they would get. But if this was all gone, this was empty, then I would say, well, probably if you're starting to get an infection, hypothetically, I might tell them that they need to lance it, and that they need to soak it in hot, salty water, 2 or 3 times a day for a couple days, and that'll usually draw the infection out, hypothetically, if I were to tell that to somebody. So they could take that advice, or they could call me a quack and said that's crazy, and they're gonna go find some antibiotics, which I recommend. That's what you get. Okay, get a doctor and get treated with antibiotics. But if that's not available, and they call me a quack, and their hands started getting more infected, and I would tell them that they're welcome to come back here in 2 weeks, 3 weeks, or whatever, whenever their hands started stinking and getting gangrene, and they're welcome to use my axe and my sawzall to chop it off. Okay, now guys, that's conventional medicine and amputation. Okay, so you could try whatever, or you can just let whatever happen to you. That's up to you. Okay, but I know what I'm going to be doing. I would be soaking that infection in hot, salty water. Now, if it goes into sepsis and it goes in your system, I don't have a backyard remedy for that, guys. Okay, you need to go to a hospital. If a hospital's not available, maybe somebody can chime in with an idea. I don't know. But let me just show you some stuff here, guys. Now, like I said, I like the conventional medicine. That's the best way to go. So this is just an organizer, and I've got some of these right here. Bandages, wound wrap. You might want to get some of this if you get a rash, or this has some really good healing properties. My wife tried the generic brand from Walmart, and it didn't work as good. So that, we've got some tape, and I've got some black electrical tape here, tape measure. Now guys, I've got a whistle. If I'm working on somebody and I'm busy with other people, and you know, they can blow this whistle maybe if they can and get my attention if they need help, you know, because there's probably not going to be a little bell that they can press or whatever. So whistles. And guys, you really should have a pair of these. You know, if you have, I need to get some of those clippers that have like a handle on them, but if you have an ingrown toenail, which I had that happen one time, and I cut it out and I soaked it in that hot salty water, and it pulled that infection out of there. I can't tell you how painful that was, but I did do that. And of course, you know, you probably want to have one of these on hand. My wife has one in her car, and you definitely want to have a tourniquet. And these are dental irrigation things, so if you have a wound, you can get some sterilized water and mix it with something antiseptic, and you can clean wounds out with it. And we've got some needles and a thermometer. Okay guys, that can tell you a lot. Now guys, I don't know if y'all have ever gotten one of those heat rashes, but I get that every now and then, and this or zinc oxide is the only thing that will tame it. So it's very painful. And of course you want to have a couple markers. You know, of course if you put a tourniquet on somebody, you want to write down the time and adjust it every so often. And I've got some of these. I might have to shave someone's head or some area that's, you know, hairy, and clean it up, and so that it can be worked on, you know. It needs to be stitched up. And then yeah, you should have some of these for, you know, hypothermia. That's just, you know, just standard stuff you should have. And I've got some gauze here. So I've got some wrap. And guys, something else I carry around in my medical kit is this, you know. And I've got several different flavors. You know, you probably want to go with what's really popular. You know, something like that, or you know, maybe some of these. And guys, I know a lot of preppers out there and survivalists say that they will never ever trade any ammo. They just won't do it. And what I say to you people out there is that if you have a loved one and they have an appendicitis, and you happen to locate a doctor, and you know their price might be, I don't know, it might be 500 rounds of this stuff right here. You know, I would trade that for, you know, a son, a daughter, wife, you know, loved one, friend, whatever. If that was the price, I'd be trading that ammo to get that doctor to do that surgery on somebody if money wasn't worth anything, or if they needed some ammo. But you know, that's your choice. And guys, I personally, I wouldn't trade ammo to like MS-13 gang members, okay? And I wouldn't trade ammo with the ATF, because then they could come back later and say, oh, we made a new law where you can't trade ammo. So I wouldn't trade with them. Guys, if I was going to trade or barter ammo in an emergency situation, it would be with people I knew, okay? Not Joe Blow down the street or somebody like that I don't know on it. Because like I said, I'm concerned, like these other survivalists and preppers, that I don't want it used on me. So, okay guys, I've got some of this. You can buy this online, and you need to know the dosages. I'm not qualified to tell you the dosages. And I don't even know if I'm allowed to say ivermectin. Okay, this stuff right here was demonized by the media. This stuff is really bad. Now, I've got some, and it is for, well, I'm not going to say what it's for, but anyway, I have some. But the thing is, guys, like I said, the video is, you know, conventional, unconventional medicine, because eventually this stuff is going to run out right here, and you know, it's not going to be available. So let's move into some more stuff right here. This is just a regular ammo can. Of course, you know, I know the new thing is you're not supposed to, you know, put your mouth on people and anything, but there might be a need where that arises, and it's for babies too. This right here, guys, is my unconventional medicine, and I guess if I were to run out of conventional wound seal or wrap or whatever, that this could literally patch someone up, or you could make a sling out of it. You know, it has a lot of uses. Now, like I said, I don't, this is what I'm doing. I don't recommend you do that, okay? So, and then, you know, you definitely want to have several of these. I got this at Costco. I think you can buy one from the Southern Prepper, but, and then this micro cord can be very handy. And I've got some wipes. And guys, you definitely want to have some sutures. These are really inexpensive. I think I got both of this here for less than $30, and they come with several things, and they have the tools, and you should learn how to do a suture on yourself, okay? So definitely recommend that. And this right here, guys, could be a real lifesaver for splinting someone until you can get proper medical care. More wipes. Paracord could be very handy. Yeah, I've got some flashlights, but this right here is, you know, I don't know, in case I needed to, I don't know, identify somebody or do something. I don't know. Anyway, I've got it there. What else do we have over here? Okay, guys, I'm going to say for 99%, and I've got some Imodium there too for those unexpected surprises when Imodium's not available. But this is Neosporin, and I would say for 99.9% of the injuries you would encounter in the SHTF, that if you clean it, get some soap here, clean the wound, put some peroxide on it, a little Neosporin, and bandage it up, you're probably going to be good. All right, now for the major stuff, that's another story. To that, okay. Unconventional. Okay. I've got these little things around here so they don't bounce around and break. But that's salt. That's actually Himalayan salt. Now, guys, this is probably my number one go-to unconventional treatment. And like I said, if you get an infection, you can usually soak it in hot, salty water. Now, how hot should the water be? It should be as hot as you can stand it. If it's boiling, it's too hot, okay? If it's lukewarm, you know, it needs to be initially hot, and you can pull your hand or whatever is bothering you. You know, like I had that infection in my ingrown toenail. You can pull it in and out, but you got to do it for 30 minutes, okay? So, and this is just a molasses bottle I left over. 30 minutes, and usually that'll, like I said, draw it right out. This also, guys, I had a thing on my back, I think ever since I got married, and my wife would go in there with a needle and she would, you know, get some stuff out of it, and it would fill up. And I mean, this has been going on for years and years and years. And I, last August, so this is June, August of 22, it got really flared up and painful back there, and I asked her to look at it, and she said it looked angry, you know. So she got the needle out, and she got some stuff out of it, and got some more stuff out of it over a couple days, and then I had her put Neosporin and peroxide on there, and it kept filling up and filling up and filling up. So finally, August of 22, I had her pack the wound with this stuff right here. Okay, now I'm not advising you to do that, okay? But I was tired of that thing being back there, and she packed it full of salt, and guys, I got to tell you, it burned all day at work, and it was very noticeable. And then the next morning I had her do it again. And I want you to know that was 10 months ago, and that thing has completely disappeared. I haven't had it return. Okay, so salt, you know, for minor stuff can have a lot of healing benefits. Just like if you have cuts and you go in the Clearwater Beach. I don't know if I'd go in Clearwater Beach nowadays, but when I was a kid, you go in there and stuff would heal up a lot faster with salt. And this could be used as an electrolyte. You can put it in water. You know, there's a lot of different uses you can have for salt. Okay. Okay, and The next thing is, I don't know if y'all know what that is, but that is just regular old sucrose or sugar, table sugar. It's probably made out of beets, so genetically modified. But this stuff right here, I bought this book back in '93 from the Paladin Press. Some of y'all might recognize that. And this is a wealth of information if let's just say, like I said, a doctor or a hospital or an emergency room is not available to you, or an urgent care. This right here, I'm not going to go into how it would be used, but this can have a lot of uses, okay? And if you don't have a copy of this book, I recommend it, okay? Now this right here, guys, is just cayenne pepper. And this can, if you have a small wound or whatever and it won't stop bleeding, you can pour this in there and it acts like a quick clot. Now, if you have quick clot, use quick clot and clean the wound, debridle it, get all that stuff out of there. Same thing with this. Get it all cleaned out after the bleeding stops, and then you can suture it up, okay? And hopefully you have some antibiotics to go along with it and know how to use it. But this right here is an awesome thing to have. Now guys, I don't primarily use it for stop the bleeding, you know, but this also has pain management stuff in it. Now I got a terrible pain on my shin. I don't know, this was probably about 8 years ago, 2015. This is 2023. Terrible pain, and what I did is I mixed some of this up with olive oil and put that on there, and it literally killed the pain, okay? I got some habanero and mixed that up with olive oil, and that was even stronger pain relief. The only problem was I would rub it at night in my sleep, and then I would rub my eyes, and you know, that was very unpleasant. So if you use this, you need to wrap it up. But my wife has been doing this thing here lately where we do olive oil. I do a 1/4 teaspoon of cayenne and some lemon juice and a teaspoon of honey, and we've been doing that. And guys, I don't have any back pain anymore. Now, like I said, I'm not giving you any medical advice, okay? My wife is doing a full teaspoon, and you have to eat something. I did a half a teaspoon of it, and it upset my tummy because I didn't eat anything. So, but as far as pain, my back pain is virtually gone. Now, is it because of this? I don't know. I haven't done any empirical data or tests or anything like that. But this does have pain management potential in it, and can save you from a lot of discomfort. Now, I would not put that on, you know, a mouth, eye, you know, anything sensitive, guys, your nose. These eyedroppers, you can get these from the dollar store. Of course, now it's $1.25 plus tax, and you know, you can use these for eyedroppers if you needed to. This right here, guys, you can look it up for yourself if you want to use this. Now, I know a lot of people say you'll turn blue if you use this stuff. Well, I've been using it for over 30 years. You know, I read about this in the American Survival Guide. And it has a lot of, let's say, healing benefits. And one of the benefits, now, like I said, guys, I don't recommend you do this, but I got pink eye a while back, and you know, when I was a kid, my mom was a nurse, and she would just bring the stuff home from the hospital. She'd get a doctor to give it to her. But I don't have that option anymore. I got pink eye, and a little drop of that with one of these, and it, let's just say it went away. Now, like I said, I'm not telling you to do that, but you don't have access to medical care and this is available and that's your only option, then you might consider it. I'm not telling you to, but the other thing too, guys, is we had some hurricanes roll through here in the Bay Area about 2004. That was 19 years ago, and everything was closed down, and I got an earache, so I took a teaspoon of this 3 times a day for 3 days, and it went away. Now, guys, did this make it go away, or did it go away on its own? I don't know. You know, if you have an earache, go to a doctor. But if it's not available, then you have options. Now, guys, this stuff right here, my mom years ago got a rash on her face, and she went to a dermatologist, and they gave her all these creams and all this type of stuff, and nothing would make that rash go away. And my dad was telling somebody that he worked with about, and they said, oh, put some sulfur on it. Well, they got some Vaseline and some of this stuff, and this is so old, Eckerd Drugs isn't even around anymore. But they did that, and her rash went away, okay, miraculously. I got creeping eruption. Okay, I guess that's what it's called. Many years ago, from crawling underneath the trailer, I was running some wiring, and I got this rash right on the edge of my belly, and it would burn and itch, and then it looked like it moved. So I went to the doctor immediately, and the doctor looked at it and he said, "Oh, you have creeping eruption." So he prescribed, I don't know how many milligrams it was, of thiabenzidole, and I had to take these horse pills and chew them up for 3 days, and then it killed it, made it go away. And he said it was from cat excrement underneath the trailer, and apparently my shirt had lifted up right there, and I got some on there. It was very unpleasant, and I had to change out some axles for my dad on his boat one time, and I laid on the ground, and there again I got it all over my back. I went to the doctor, got some thiabenzidole, and it cleared it up. But like I said, if a doctor is not available, I got that creeping eruption. I went out in the yard barefoot one day, and then my toe started burning, and it got this stuff, and I put this on there, and with Vaseline, and it killed it. I think, or I don't know if I think I used new stock that you can get from the animal feed store. I think that's what I did, and it killed it in a couple days. But I was talking to a doctor about that, and I told him what I did, and he said, "Ooh, you should get the thiabenzidole, because if there's any parasites in you internally, it kills them. This just kills its stuff externally." Now, guys, I met a guy, and this was in 1996, and he was 95 years old, and this was over in St. Petersburg, and we were working on his air conditioner there, and he said that he had been born on the property in, I guess, 1901, and the doctor would come and see him once a year and give him sulfur tablets. Now, guys, I don't recommend you ingest sulfur internally, okay, because it could probably kill you. That's why the older people, I guess, were so tough. But if I had parasites, and I would be real skeptical about taking any of this internally, so I just probably wouldn't do it. But anyway, that has some benefits. What else do we have here? Oh, guys, you got to have trauma shears, and you need some Advil and ibuprofen and all that. And then this is 3M Vet. I can't even talk. 3M Vet Bond. Okay. Now this was about $25, and I bought this for my dogs. Okay, and if they get a cut, then I'm gonna glue them up with this stuff. Now you can buy I don't know what it's called, Durabond or whatever, that's FDA approved, and it's like $290 for the same amount here. So if my dog got a little cut or whatever, I would of course clean it, and then probably, I don't know, put some peroxide and Neosporin on it, and then I would actually I'd put peroxide on it, then I would clean it, and then I would glue this up. And guys, you want to make sure you have gloves on, because you don't want to glue your finger to your dog, or whatever you're working on. So but anyway, this is relatively inexpensive, and instead of suturing yourself, if it's something minor, this right here is gonna be really nice, especially for like I said, fixing my pets. Okay, so anyway, there you go, guys. That is my overview, and then I got that for the people who want to call me a quack. They can take care of their medicine. They're welcome to borrow those right there to take care of themselves if they let their problem go too far. But okay, guys, I just wanted to put that out there, and let me know if you have any home remedies or anything like that. Homestead Prepper out.